how do you right a wrong? Sometimes you can't. So, in my role as an elected official, I decided to put in meaningful legislation to ensure parents are educated to prevent future wrongs. I am a regret mom. You prepare for your firstborn child and you go through lots of imaginary scenarios and how you're going to be as a parent, how you're going to care for your newborn baby, what labor and delivery will look like. Um, Nobody prepares you for the wound care involved when you choose circumcision for your son. That was a startling process for me. In my postpartum haze, I think most of you can agree that nobody's in their right mind after giving birth. We're sleep deprived. We're healing from our own surgical wounds or the birth process. And there was no way for me to absorb any kind of, informed consent had it been given to me about the choice of circumcision. My son was born healthy. At about 24 hours old, a nurse came into my room and said, from my recollection, it's time for his newborn screen. Do you want him circumcised? My husband at the time and I chose yes, we do. We didn't know. We didn't even think it was an option to not. That was just normal in our culture. They took him. He was returned to us. I don't remember signing anything. I'm sure I did. I'm sure I signed some sort of invasive procedure, general consent form. Obviously, I delivered at Exeter Hospital. I'm sure they gave me some sort of sign off for this. He was returned to me. He was all right. A couple hours later, he became very distressed. He was crying, and 24 hours before, he was just a normal, healthy, sleepy baby. The nurse came in and said, we're worried about his respiratory rate. He was having very fast, rapid breathing. And we said, we don't know what's going on, but something's wrong. So they took him from our room, which at the time they had a baby friendly policy. So the baby stays in the room with you. And they took him from us and they put him in the special care nursery for 5 days. And they could not figure out what was wrong with him. He was just upset. So they put an IV in his head because as babies, it's hard to get an IV. So they put an IV and gave him sugar water, he was not breastfeeding. So back then you're a new mom trying to learn how to breastfeed. So they do tummy to tummy when you try to breastfeed. And I'm assuming, looking back on it now, that his wound hurt him after the hours after the local anesthetic would have worn off, and he was distressed, and it was hard for him to breastfeed. So they taught me how to do what's called the football hold, which some of the moms will understand, but basically they lay behind you and their belly is up to the ceiling. So I wasn't making contact with his wound. And he was able to kind of breastfeed, and we eventually got out of there. He had jaundice, which may or may not be related to the procedure. But again, the wound care I was not prepared for. Constant attention and cleaning him and repairing what I chose to do to him lasted at least 2 years. I never had a healthy child when it comes to his genitals after that. And we were referred to a top pediatric urologist in Manchester sometime before he turned 1 because he had issues. I don't want to say specifically, but he had complications. And she said we could offer a repair procedure, like a new circumcision or something, or we could wait. And maybe by the time he was walking, or maybe when he reaches puberty, it would resolve. So obviously after that trauma, we chose not to do anything and just wait because I put him through more. 2 nights ago in my research, I found out one of my son's conditions is listed as a diagnosis code for revisions and repairs in this state under the Medicaid billings. So I know now he turns 11 next week, and I know now that we're not done. So I have to go back and find somebody to help us. I will spend the rest of my life in regret, and I hope he forgives me, and I have to have this conversation with him because he doesn't know what's going on. But I went on to have 2 more children. My last son, he's 2.5, he's intact, and no health issues, no special care, no trauma. I'm wrapping up, I promise. I asked the committee to be open to this discussion because infant circumcision is the only routine surgery performed on healthy infants that is not medically necessary. So that's why a special form is required. According to Dr. David Jones, who couldn't be here, of University of Vermont Medical Center, Medicaid and other third-party payers require specific consent forms for other elective procedures like tubal ligations and vasectomies, and that's why we need a special form. In closing, I introduced this bill for two mottos that I live by, and that's know better, do better, and courage is contagious. I am open to all amendments. I just want this conversation to happen. And I'd prefer not to take any questions because I feel like there's plenty of people and a lot of people to get through. I'm sure that someone can answer if the committee's okay with that.
Thank you very much.
Thank you so much.
Thank you. And with that, I'll call Representative Burrows.
Thank you again. I'm going to be super quick because we're going to move along, get back on schedule. This bill removes infant circumcision from a covered Medicaid expense in New Hampshire. This law has passed in similarity in 17 states. I'm going to pass around a bunch of information specifically on the cost reductions and some other testimony provided to me. The cost reductions to the state is estimated at $90,000. If we no longer covered it, I would estimate it's a lot larger than that based on that is just for the billing codes. It does not include the facility charge, provider charges, supplies, that sort of thing. In addition, there's about a 10% revision rate reported. So I got the billing codes for that for children in New Hampshire over the past 5 years, and it's $177,000 in billing codes just to repair circumcisions for New Hampshire the past 5 years. That's it. Any questions?
Any questions? Representative Palmer.
So in that last part, so let's say somebody has their child is circumcised. They went through the whole thing. They really read up about it. They knew exactly what they're doing. That's what they wanted to do. And they have Medicaid. They paid for it out of pocket to have the circumcision. Now they have a complication. Are they not going to be able to get medical coverage for repair?
No, I suggest we do cover it because that is an injury. What I suggest is that it would be reduced. There wouldn't be follow-up care if we stop covering or encourage them to not happen through coverage. So that's what I was trying to paint. Yes, yes. Please help the children. Yes.